Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hey, what's up, family? Dr. G and Dr. B here with another exciting episode of Vitality Vault, brought to you by us, AMG. And before we get started, we want to wish Dr. B a happy birthday. Mike, our producer, you want to sing along with me? Let's sing. Happy birthday to you. Happy birthday to you. Happy birthday, dear Dr. B. Happy birthday to you. And look what I wore today. I don't know if you can see this, but these are my Dr. B socks. I'm going to get close to the camera. Watch. Look at my camera.
Oh, you got to come over here. You got to come over here, right here, in the middle.
No, stay right there. I'll change cameras. Okay.
There, come over here. Oh, look. I don't know if you can see this. Look, it's my Dr. B socks. I'm wearing my Dr. B socks today.
Thank you, guys. Thank you.
So to start off today, we are going to be talking about a topic that's near and dear to both of our hearts because we have a lot of people who are dealing with this on a daily, hourly, minute-by-minute basis, and it is inflammation. This is what we're doing. So we want to kind of unravel, at least in this particular episode, we want to do a series of these episodes talking about different ways inflammation can negatively impact health and why it's important for us to fight inflammation.
Yes.
What do you think, Dr. B?
So not just with this inflammation series in a Vitality Vault, but also for our upcoming other episodes, we'll be talking, you hear us say a lot in terms of inflammation. So the problem is inflammation is actually the root of most chronic medical problems. And so we want to just give you a foundation and give you an idea of what is inflammation, how does it affect our body, what to look out for, what to do to help to reduce our inflammation. So that's what we're going to be doing in the next few episodes.
All right, so let's break down inflammation. So we know what it is as physicians. It's basically your body's response to an attack, okay? It's an immune response to an attack, whether it be an injury, like, when you sprain your ankle or you roll your ankle as a kid, it swelled up, or you got your skin cut and then you got a little bacterial infection. All those things are insults to the body that lead to an inflammatory response. So inflammation in itself is not bad. It really isn't bad. It is your body's way of kind of protecting and starting that healing process. So we just got to be careful and manage how it happens and also manage how we deal with it and allow it to kind of die down in a natural way or use medications to kind of help heal because the body does need help sometimes. Mm-hmm. So it's important for us when we think of inflammation, we look at it as that. So it's an insult that happens and your body releases mediators, cytokines and chemokines to help recruit your warriors or your immune cells to be able to fight whatever it is. Now, the problem is inflammation can be acute and it can also be chronic. And that's where diseases can take place.
Right. And as you mentioned, Dr. G, the acute inflammation is necessary for your body to repair itself. So, like when you have an injured knee or ankle and it's got swollen, it's red, it's warm to the touch, that's all those cytokines and all those mediators coming in to do their job. And that's what they're doing. They're trying to take away whatever we call insult that caused the injury and trying to heal. Let's say if you had a ligament or a tendon, little tear from the injury. It helps to heal that area. So it brings in all the fighter cells to regenerate and to heal. But of course, with chronic inflammation that we'll talk about, that could present itself to more problems later on. So here's just showing the difference between acute and chronic inflammation. We talked a lot just now about acute inflammation, and we'll be focusing on chronic inflammation for the rest of this episode. Chronic inflammation is associated with a certain chronic medical conditions, including cardiovascular disease, type 2 diabetes, and some autoimmune disorders as well. And chronic inflammation is usually a representation of a chronic period of low-grade inflammation. You may or may not be aware that the inflammation is attacking your body, but with continuous chronic low-grade inflammation, it can lead to various different diseases or medical conditions, especially those that are metabolically based.
And one major one that we didn't have on the slide, but we should mention is obesity. What most people don't realize, obesity is a chronic inflammatory condition. Because of all the extra fat cells that we carry around, those are harbingers of death. Basically, they're carrying all the negative signals and they're just releasing it slowly into your system like a toxic waste dump. And what happens is that's where we see a lot of metabolic diseases. And for some patients, sadly, even cancers. We are seeing more and more cancers being linked to obesity. And it's chronic inflammation. So we got to really be careful. And this is another reason why we are big on staying healthy and kind of reducing the amount of fat mass you have, because you want to reduce the amount of poison or toxins you have swimming around in your body.
Unfortunately, those fat cells, they do keep a lot of toxins in. So minimizing the amount of fat cells we have is actually great for your longevity and health.
Yeah, fat cells are godlike. They are just difficult to kill. Oh my gosh. So let's talk about common triggers of inflammation. So we can break these up into 4 main categories, whether it's dietary, lifestyle, environmental, or genetic. And I mean, we already know, like in layman's terms, what these are. So when you think of dietary, when you eat too much processed foods, when you eat too much foods that are high in fat, high in sugar, all these dyes, high fructose corn syrup, all these things are going to trigger inflammatory responses in the body. If we go to the next section, then we look at environmental, and that is more where you live. Whether you're exposed to things like pesticides in the water you drink, or even some of the foods we eat sprayed with these things, that can also cause issues. Lifestyle, we have a lot of people who still smoke. I don't get it, but a lot of people who still smoke, despite all the data to show them that smoking is not good for you and does increase your inflammation in the body. And then it all trickles down to the last one, which is genetics. I mean, we all have some level of predisposition to genetic factors. We all have some predisposition to inflammation based on the genes that we have. So what's passed down from your generation. I heard this one saying recently on a talk that I was listening to, where they were saying that genetics loads the gun, our environment pulls the trigger. So even though you might be someone that says, oh, well, my dad had RA, so I'm going to get it, I would come back and be like, not necessarily. A lot of these genetic diseases that we have, or these autoimmune where it's in generations, it's because people don't take the time to recognize that, yes, I am genetically predispositioned, but it doesn't mean that I will get it.
Absolutely.
If I live a life that's going to increase my inflammation, then yes, I stand a chance of getting it.
Yeah.
So it's not a one and done deal. It's yes, you are predisposed, but you have to be careful not to pull that trigger on that gun.
Absolutely. It's based on the lifestyle factors.
Yes.
because these genetic predispositions, they can be induced by certain lifestyle factors. So, we spoke about smoking, there's excessive alcohol use, if you're very sedentary, not exercising enough. So there's certain things that if you don't lead the most healthy lifestyle, you could definitely induce some of those genes, or just put yourself up at risk of developing this chronic inflammatory state and lead, going down the road of these chronic medical problems. So I think, it's really what we put into our body and what we expose our body to. That's really important. So here we have just some symptoms of acute and chronic inflammation. We spoke about the acute inflammation before with the pain, swelling, redness, heat. For chronic inflammation, typically you would experience fatigue. Some people experience this fever or a little higher temperature than their basal temp. Weight gain is a big one because of all those toxins, etc. You can that we talked about in the fat cells, and just other systemic symptoms. Some people experience joint aches, muscle pain. Some of my patients complain about brain fog, just not able to concentrate as well, having trouble recalling certain things, and just your quality of life overall just doesn't feel the same. You feel like there's something going on, but you can't quite put your finger on it. It's not something specific. You just feel like you're off.
Yes.
Fatigued and just burning a little bit more than usual.
All right, guys, that was understanding inflammation. In this episode, we decided to kind of break it down real quick so you understand where we're coming from. And look out for the future episodes on inflammation where we kind of go through a couple different organ systems which we feel are very important that people talk about when they come to see us. So look out for those episodes on where we dive deeper into inflammation and things you can do from day one to help reduce that burn.
All right, guys, see you in the next episode of Vitality Vault.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.